questions you may have about epilepsy, now would be a good time to call on 1300 222 774 because Dr. Emma Foster, who is a neurologist at the Alfred, is with me. And Emma, welcome. I can't believe the statistics that 1 in 25 Australians will be diagnosed with epilepsy in their lifetime.
Absolutely. It's so common and it can happen at any age.
Wow. Take us through, I mean, I have friends who do have epilepsy, but what actually is it?
Yeah, so epilepsy is a disorder and people with epilepsy just have a high likelihood of having unprovoked or spontaneous seizures. A seizure is a sudden, brief disruption of normal brain activity due to abnormal firing of the brain's nerve cells. But there are many different causes of epilepsy, and so epilepsy can look different for everybody.
Yeah. And is it hereditary in any way?
There are some genes that can cause epilepsy, but there's also reasons people might develop epilepsy over their lifetime. For example, head trauma or stroke.
Right. Okay. So just because you haven't had it doesn't mean that you might not get it in the future.
Absolutely. In fact, if you're an adult and you develop epilepsy for the first time, it's most common to get that after the age of 65.
Wow. Okay, that's worrying. All right. I am with Dr. Emma Foster. She's, I think, the youngest neurologist in the world because she looks about 12, but I'm sure you're older than that, Emma, and that's a compliment at the Alfred. If you do have a question about epilepsy, we do have her with us and she can answer your questions, 1300 222 774. So you say there are lots of types of epilepsy. Obviously, some a lot more serious than others.
Yeah, absolutely. So it's a really big spectrum and it affects people differently, also depending on who they are, what other conditions they have, what they're doing in their life. Broadly speaking, when the doctors think about epilepsy, we kind of group them into a group where the epilepsy starts on one part of the brain or the epilepsy starts all over at the same time, all over the brain. I guess from an experience point of view, the epilepsies that start on one part of the brain often do come with symptoms that people can tell us about. The temporal lobe in the brain, which is sort of just behind your ears, is a very common place where epilepsy can start. And people can get these intense feelings of deja vu. So almost that feeling like they know what's going to happen next.
We spoke about deja vu last week on the show and I can't remember who it was we were talking to, but they said that. They brought that up. Wow, why?
Can be. It's just to do with where the seizures disrupt what sort of area of the brain. So, for example, if you have a seizure that disrupts your motor strip, you might get symptoms with jerking or jolting on your body. If you have a seizure in the sensory area of the brain, you might feel pins and needles, for example.
Right, so symptoms potentially that deja vu, feeling pins and needles, some jerking, obviously seizures. Any others that you should look out for, that people should look at?
I think one of the common things I see in an adult neurology clinic is older people, so often after the age of 60, who come in with very brief spells of blankness. So a family member might say, I was eating dinner with my dad and he just stared blankly ahead for a few seconds, stopped talking. When he came to, he was really out of it and a bit confused and tired for a few hours later. And that could be a seizure.
And that could be confused with a stroke, couldn't it, a little bit by that? Would people perhaps think it could have been that one or the other?
Absolutely. And I think that there is sometimes uncertainty if someone has a sudden onset of a neurological deficit, whether it's a change in their awareness or change in their strength or their sensations. It's really important to be evaluated urgently for that.
Okay, I'm talking to Dr. Emma Foster, who is a neurologist at the Alfred. If you have any questions about epilepsy, give us a ring, 1300 222 774. It can also be triggered, can't it? Like certain things can trigger epilepsy. What would they be?
Absolutely. So people already need to have an epilepsy tendency, so the epilepsy already exists. And then for certain types of epilepsy, I think what's commonly known as flashing lights for particular types of epilepsy can sometimes induce a seizure. And there's some other rarer epilepsies we call reflex epilepsies. So, for example, sometimes reading long or complex texts can induce a seizure for some types of epilepsy.
And the problem, I only ask you this because I remember I had a friend who had a young daughter and she'd had epileptic fits since she was a baby and was terribly brain damaged as a result of it. So lots of seizures can really cause damage, can't they?
Yeah, And I think we worry about that. We also worry about injuries from seizures. So if people have a seizure and fall down, they can sustain head injuries, fractures, dislocations, and car accidents are the big one as well that we worry about.
Absolutely. So we'll get to that in a minute, what you should do if someone does have a seizure. Corey is in Fairfield. Corey, have you had an experience with epilepsy? Hi, Corey.
Yes.
Hi.
So I have actually. I've had. Yes, I have. How are you going,
Good.
Emma and Bridge?
Hello, Corey.
Hi, Corey.
We'll just get you to speak into the phone, Corey, if you could.
Yes. Sorry, that's it. I had a head injury when I was in my late 20s, snowboarding, hit a tree. But 20 years later, I had a seizure while I was asleep, which worried my wife. But they said I've got nocturnal epilepsy, which I still, I've lived with that for about 10 years now.
What does that mean, Corey?
I
Corey,
only have-
not you. Sorry, I meant to ask Emma, Corey. Sorry.
Yeah.
Thanks. Oh, thanks for sharing that that story, and I'm sorry that happened for you, Corey. I think sort of two things just to generally discuss there is that we know that traumatic brain injury, so for example, the snowboarded accident, but we also see that if people have had a car accident or had a fall and maybe cracked their skull, can over time develop epilepsy circuits in that damaged area of the brain. And nocturnal seizures, nocturnal means at night. And so some types of epilepsy do tend to happen more at nighttime when people are sleeping than during the daytime.
And is it dangerous to have one during the night?
Yeah, so having one during the night has got its unique safety concerns compared to during the day. And so it's one of the, we try to treat all types of epilepsy, and the goal is always to get people seizure free.
Yeah. Corey, how do you handle it? How do you manage it?
I'm not on any medication. I try not to get too tired. So basically, when I'm at risk, a lot of time in life you don't think you're stressed, but you're probably fairly stressed and you're not sleeping well. So I've had 3 years where I had seizure free. And then I moved to Alice Springs for a bit, and I had 3 in a year.
Yeah.
But
Corey,
that was just due to change. Yeah.
Okay, well, stay well, and thank you very much for calling us. 1300 222 774. You talked about driving before. What are the rules around if you are an epileptic and being allowed to drive?
Absolutely. So there's published guidelines that are free to download online from Austroads, but Austroads is the body that basically determines what length of time people have to be off the roads for all kinds of medical conditions. If we remember, people have temporary no driving periods for after a heart attack, after a stroke, and also after seizures. The guidelines do get updated from time to time, and the doctor will read it with you and determine through an algorithm. It's like a decision tree, yes, no,
whether you're up to it or not.
But after a epileptic seizure, there's always a minimum driving time off the road.
After each seizure, is there?
That's right, and it resets when a new seizure comes through.
Okay, Rachel has texted us and says, I have epilepsy. I had a right temporal lobectomy 2 years ago. So lucky. Science is amazing and covered by Medicare. So, Rachel, thank you. That makes me think it is fixable in some cases.
Yeah, that's a great question, and we've certainly I don't know Rachel, but just speaking generally, when people have ongoing seizures after they've tried at least 2 anti-seizure medication, they may be a candidate for epilepsy surgery. Generally, we need to be able to identify a clear spot on the brain where the seizures come from, and make sure that it would be safe to do surgery. So if the spot the seizure comes from is right next to, say, the language centre, surgery might be a bit dangerous because it might mean that people can't speak after. But for people who are good candidates, surgery can have a really good outcome and either greatly reduce the amount of anti-seizure medications people need, and some people have great outcomes.
So there are good medications that can work.
Yes, so about 50% of people will become seizure-free on the very first anti-seizure medication they try, and about 2/3 of people will be seizure-free on medications alone. About 1/3 of people will continue experiencing seizures, and for them, they might benefit from advanced therapies that include surgery, neuromodulation, which is like a pacemaker for the brain, and ketogenic diet therapy. And those therapies are generally accessible via comprehensive epilepsy centres, which are specialist centres usually attached to major city hospitals.
Okay, we are talking about epilepsy. I'm with Dr. Emma Foster. If you'd like to join the conversation, give us a ring, 1300 222 774. I've got a text here, Emma. My 2 daughters had a seizure due to a neurological disorder they both have called MLD. They had different types of seizures and they are now on medication. So that's something you're familiar with, no doubt.
Yeah. Oh, thanks for sharing that, and I'm sorry to hear that. So definitely genes can sometimes, a genetic predisposition to epilepsy doesn't necessarily guarantee the person will get epilepsy, and people who have genes might express their epilepsy in different ways. Yeah.
There used to be a lot of stigma around epilepsy. Do you think that has got better?
I perhaps would need to talk more to people who are living with epilepsy, but certainly I hope that's the case because it's such a common condition. And I think it's good to do a shout out to some of our excellent national epilepsy advocacy services like Epilepsy Foundation that do a lot of work to try and educate in workplaces, schools, and remove the stigma and build the support networks around people and their families living with epilepsy.
Absolutely. Emma, I'm really interested to know what you should do if somebody does have a seizure. In the old days, I know it was a very different setup. What is the right thing to do if someone who you happen to be with has a seizure?
So it's pretty scary watching someone have a seizure. If you're able to, the person's often on the ground shaking. That's the kind of seizure that we often think about. If you can, safely roll them onto their side. We call that the recovery position. Try and move furniture, or if it's safe to do so, away so they can't hit themselves on it. Do not put anything in their mouth. There used to be a thing, put a spoon in their mouth to stop them swallowing the tongue. But this ends up being quite dangerous. People sometimes break their teeth. Yeah. Or sometimes if people put fingers in other people's mouths, their fingers can be severely bitten. So we don't advise that. And call 000 at any point in time, but especially if that seizure is going for more than a few minutes, please get the ambulance to come.
Chris joins us from Bacchus Marsh. You've got a question, have you, for Emma? Hello, Chris.
Not so much a question, Jacinta, just wondering, I had a stroke in 2011 and I had 2 seizures after the stroke, which is quite common. I think 1 in 10 people do that. But you don't get treated for epilepsy, post-stroke epilepsy until you have your second seizure. In my second seizure, I broke my back.
Oh, goodness.
Which I still have a lot of trouble with.
Gosh, I'm sorry to hear that.
Yeah, well, it's pretty painful, but that's not the point. My point, I guess, is why don't you treat people after the first seizure rather than waiting for them to have the second seizure?
Yeah, that's a great point. And I'm not sure when that second seizure happened relative to the stroke, but they have actually. So we've got the International League Against Epilepsy, which is sort of the global epilepsy body or authority. And a few years back, they slightly altered the definition of epilepsy so people can be treated earlier. So the oldest definition of epilepsy is 2 or more seizures more than 24 hours apart without a clear provocation. In addition, nowadays, if you have 1 seizure and there's a clear reason that you had the seizure and that seizure, that reason is permanent, so for example, the scarring on the brain after a stroke, that would also now meet epilepsy diagnostic criteria. And at that point, the doctor would discuss with the patient starting treatment.
Okay, good on you. Thank you, Chris. Rachel joins us. I'm talking to Dr. Emma Foster, who is a neurologist at the Alfred. We're talking about epilepsy. Rachel, how are you?
I missed that. I'm Rachel.
Hello.
And I have epilepsy and I got it when I was 26, 25 years after I had a brain injury, and I was completely seizure-free for a long time, and then about 6 years ago I started having the temporal, vague out seizures. And I would just vague out and say random things to people, and people just thought I was a bit insane, like weirder than normal. And then after a few years, my epileptologist, Sam Berkovic, he suggested having surgery. So I went through all the testing that, you know, where you go and lie in a bed and they take the medication away from you and induce seizures. And then I qualified for brain surgery, so I had a right temporal lobectomy at the Austin Hospital about 2 years ago, and that was amazing because I haven't had any seizures since. And how amazing are people who do the research into all of this?
That's such a good story.
That's a great
Thanks,
story, Rachel. Thank you very much for sharing it. It's always lovely, isn't it, to hear? Oh, sorry. Back to you. Yes, Rachel.
No,
Sorry.
okay.
Sorry.
My epileptologist was worried. I'm a songwriter. My epileptologist was worried that I would lose my creativity, but I haven't. So that's amazing too.
That's great.
That's really interesting, though. Why might Rachel lose her creativity in that situation, Emma?
Oh, look, I think it depends. I guess they were worried possibly about with where the location was where they were going to do the surgery. Yeah. Sorry, I can't comment more than that.
No, of course, sorry. No, but what is the good news is that she has definitely not lost her creativity, as we could hear by the call. Stuart's in Buninyong. Hello, Stuart.
G'day, Brigitte. Just wondering, people with epilepsy, should they avoid alcohol at all costs, and probably smoking as well, but more so alcohol?
That's a good question, and it would be, again, a case-by-case basis, but we know certainly for specific types of epilepsy, alcohol can definitely draw down the seizure threshold, which means it's much more likely for them to have a seizure sneak, to come on through. Yeah, I think the cigarette smoking, just for general good health, including brain health and heart health, best to be off the cigarettes.
Okay, there you go, Stuart. Thank you. Kathy's in Wanturna. Hello, Kathy.
Oh, hi. I'm just ringing up. I had a seizure. Well, they thought it was a seizure. I was on an internal flight in Vietnam.
Oh, gosh.
They gave this morning tea, and my husband turned around and looked at me, and I had a biscuit sticking out of my mouth.
Oh, gosh.
He looked at me, and there was no response, and it was like over an hour. I was out of it, just sitting there. And they took me to a hospital in Vietnam. I had MRI and brain scan. Nothing showed up. I came back to Melbourne. I saw a neurologist. I had an EEG. He thought it could have been a seizure, but nothing showed up there. Also with the heart doctor, nothing showed up on my heart. But I was in a car accident when I was 18. I was unconscious and had a broken pelvis. So I don't know whether that could be something to do with it. I don't know.
Gee whiz.
Thanks so much for sharing. And I think sort of some of the things that I'm hearing is the difficulty sometimes in securing a diagnosis, and certainly the presentation you describe is something that we do see in our first seizure clinic quite a lot. Someone has had a degree of impaired awareness, and the question is, does this come from a seizure? Is it from a stroke? Is it, as you said, from a heart problem? And so we often do need to do a range of investigations. Generally, though, what we say, because we do know seizures can sometimes look like a whole range of different things, is the episode short? So does the episode itself last for less than a minute? And there can sometimes be a confusional period for hours after that. But the episode itself, whether people might experience like that strong sense of deja vu, is it less than a minute? Next is it stereotyped, which means that the person has the same types of episodes all the time? And then finally, is it a surprise? It's unpredictable when these events can come on. They can't be linked to exercise or just after eating food. And if people have got the 3 S's going, they've got the same episode that's short and can come as a surprise, it really makes us worried maybe this person has got seizures.
Okay, well, good luck, Kathy. All the very best of luck. Before we let you go, Emma, Walk for Epilepsy is back for its 8th year, and I'm really interested in this because it is a great way to break the stigma and help funds, of course. Tell us about it.
Oh, this is such a great initiative. So it's run by the Epilepsy Foundation in partnership with Epilepsy ACT, Epilepsy Queensland and Epilepsy Tasmania. Participants will be walking throughout October, so you can sign up on the Epilepsy Foundation website. You can go as an individual or go as a team. The theme is walk and talk to encourage just getting your steps in and sparking meaningful conversation about epilepsy. And participants can basically take on the 1 in 25 challenge, where they can walk, run or ride 100 kilometres or more in 25 days. Or people can just set their own distance and go at their own pace and raise funds for a good cause.
Oh, I love it. It's fantastic. Good luck with it. I hope it goes really well. Dr. Emma Foster, always love talking to you. Thank you for joining us.
Thanks so much for your time.
That is Dr. Emma Foster, neurologist at the ELF.